Dr. Elizabeth Ansert. I am the Diabetic Limb Salvage Specialist at the Thibodaux Regional Foot and Ankle Center. Today we are going to be talking about the preventative care for the diabetic feet. Diabetes is a very complicated overall systemic disease. It affects so many things in your body. It affects your nerves, it affects your muscles, it affects your bones, it affects how your body responds to infections, and it affects so many things throughout your body that it's really kind of hard to keep track of. And a lot of these manifestations of the disease, especially as the disease gets more complicated and a little bit more of a higher level disease, it really affects and starts to show in the feet, in your nails, in your skin, in your blood flow, again in your nerves, and again how your foot functions. All of that is affected by your diabetes. Because of this, we have to talk about how to try and prevent any complications that you may have with your diabetes, especially in your feet. With diabetic complications in your feet, it can lead to some very detrimental and scary things that we want to try and prevent as best we can. And our philosophy at the Foot and Ankle Center is prevention is typically the best treatment that we can provide. Try and stop problems from happening before they even start. So when you have a diabetic foot, one of the first things we want to do is we want to check it every single day to see what's changing, what's not changing, what's normal, what's not normal. So that way, if something is changing, we can catch it and do something about it before it becomes a major problem. Part of this is also to have good, proper diabetic shoes. Because everybody's feet are so unique and even the feet themselves are different from the other foot, it's really important that we make specific shoes that'll help prevent any sort of problems. As one of the big things that we see with diabetic feet that a lot of people come in for is nerve pain and not being able to feel their feet as well. So these shoes are made to help prevent and protect your feet from the world around us. And that includes checking on the inside of the shoes, make sure there's not any rocks or anything sitting on the inside of the shoe that could cause an issue, and also even checking the bottom and the outsides of the shoe, because I've seen where patients have stepped on something like a thorn or a nail or a piece of wood and they've gotten something in the bottom of their shoe, and then it goes up into their shoe and they can't feel it, so they step on it over and over and over again, and it causes all these really complex problems that we want to try and prevent. So checking our feet every day, both morning and at night if you want to be really proactive with it, and checking your shoes every day are very key aspects in trying to prevent any sort of diabetic foot complication. Additionally, it's really important that you see how you can kind of check your water or check temperatures around you. When people are drawing baths and things like that, it's really hard for them to see what the proper temperature is because the nerves in their hands and their feet don't function as well as they should. So what you actually want to do is you want to take your elbow and dip that into the water instead of using your fingers or your toes to try and test it, because with the nerves being affected by the diabetes, it makes it unable to properly detect the actual water temperature. And then one of the last things that is really, really important for diabetic feet is to never go barefoot anywhere. Our feet are very sensitive, they're very reactive, and we often don't pay attention unless we can feel that something is going on with them. And not being able to feel things and not having enough blood flow in our feet makes it very difficult for us to realize that anything is going on with our feet until it's potentially too late and we start seeing signs of infection, somebody starts getting sick, and things like that. So trying not to go barefoot is a big key in trying to prevent everything else. And then, of course, we at the Foot and Ankle Clinic will be more than happy to do regular foot exams. That includes trimming calluses if there's additional pressure areas, trying to prevent any ulcerations, taking care of any toenails, checking in between the toes to make sure there's no like wetness or anything else going on, making sure there's no signs of any sort of infection or anything that diabetics are typically more susceptible to. And then also if the foot function itself, if the bones or the muscles are adjusting or changing because of the diabetes, we can try and either prevent that from getting worse or to try and proactively try and make sure that we're correcting any sort of problems that are arising before they become major debilitating deformities. If you would like any more information, or you or yourself or one of your family members would like to come in for a diabetic screening or make an appointment for any sort of diabetic foot issues, you can reach out to myself, Dr. McKenna, or Dr. Swenson at the Thibodaux Regional Foot and Ankle Center. For an appointment, you are welcome to call 985-493-4990.